Congratulations on your pregnancy, and thank you for choosing Valley Medical Center for your delivery. Valley's Birth Center is rated one of the top 100 hospitals to give birth in and is a baby-friendly designated hospital. We have 11 labor and delivery rooms, 25 private postpartum rooms, and a 20-bed Level 3 NICU. We offer services from midwives, family practice doctors, and obstetricians to provide for your pregnancy and delivery. Our nurses are trained in lactation support, and we have lactation consultants available for additional support 7 days a week. When you arrive, you can use our free on-campus parking under the emergency department and walk through the second floor to reach the birth center. After hours, weekends, and after 5 p.m. on Monday through Friday, you will need to enter the hospital through the emergency department entrance. Someone there can direct you to the birth center located on the second floor of the main hospital. Once you enter the lobby, someone will greet you and enter you into the hospital's registration system. Please make sure that you are pre-registered for your hospital visit by calling registration. This can be done anytime after 28 weeks. This registration is different than registering in your provider's office. Next, you will stop in our OB emergency department, where a team of nurses and an OB hospitalist will examine you and care for you. OB hospitalists are available 24 hours a day. They are board-certified obstetricians who work in the OB-ED to provide evaluations, assist in emergencies in the birth center, and are available to coordinate care with your provider 24 hours a day. This is your first stop on your journey to bringing baby home. If you are in labor, we will contact your provider for the admission. If you are discharged, a summary of the stay will be sent to your provider for a smooth transition of care. If you are pre-scheduled for your admission through an induction or C-section, you will be directly admitted to a labor and delivery room. In our labor and delivery rooms, we offer a private and safe birthing experience. The equipment in the room is available to monitor and support mom and baby during the birthing process. We have central fetal monitoring so that your nurse and provider are able to view the baby's heart rate and your contractions from in or outside the room. We also have telemetry monitoring to allow for movement and walking during labor and delivery. Please talk with your provider before you arrive in labor to discuss your wishes for fetal monitoring. We encourage frequent position changes during labor and have peanut balls available to help support this. Many of our staff have attended additional training on supporting these position changes, as well as supporting an unmedicated birth. We do our best to make staffing assignments that will best meet your goals for your birthing experience. We have several options for pain relief. Each room is equipped with a whirlpool bathtub for water therapy during labor, and we have nitrous oxide, IV pain medication, and epidurals available. After your baby is delivered, the best place is for the baby to be skin to skin with mom. This helps you both transition from pregnancy to post-pregnancy. It will help to regulate baby's temperature and breathing, as well as to help establish breastfeeding. As a baby-friendly hospital, we are committed to providing breast milk as the optimal nutrition for your newborn. After delivery, we will utilize our infant security system for additional safety for your newborn until discharge. In our 2 OR suites, we can care for a planned or unplanned C-section. In the OR, we limit to 1 support person to reduce the risk of infection during the surgical birth. Anesthesia is available 24 hours a day to assist with the C-section. The OB hospitalist can attend an emergency C-section if your provider is not readily available. During the C-section, we will monitor your vital signs to ensure your safety during the procedure. Once your infant is stable, we can do skin-to-skin for transition and bonding. In the case of an emergency, the NICU team is easily accessible through the OR via our pass-through window. This also allows us to plan for some vaginal deliveries in the OR when our expert NICU team is needed. All parents look forward to healthy pregnancies and routine deliveries. Sometimes unexpected complications can happen. Valley Medical Center's state-of-the-art Level 3 NICU provides special monitoring, treatment, technology, including ventilation, and exceptional staff to care for sick or premature infants. The region's most highly respected neonatal specialists from Seattle Children's and UW Medicine Neonatology provide comprehensive, around-the-clock care for infants in VMC's NICU. This tightly coordinated team also practices developmental care, which research attributes to more positive outcomes in the sickest infants. Premature or fragile infants who require complex surgery may be transferred to a facility that offers a higher level of specialty care. Our environment is designed to help families bond with their infant by providing single-room care. Our providers and staff welcome you to stay the night with your newborn. Each of our rooms is equipped with specialty items to support your newborn at all stages and can accommodate single, twin, and triplet deliveries. Each baby will have their own monitor that is connected to the nurse's phone, so they are aware of how your baby is doing even when they are not in the room with them. The provided couch converts to a bed, and the rocking chair reclines for an additional sleeping area. There is also a refrigerator in the room to store breast milk for your baby. Valley Medical Center's 14-bed Pediatrics Unit is the only one located between Seattle and Tacoma. VMC Pediatrics staff includes nurses dedicated to the care of children and postpartum couplets. This unit provides many of the same amenities as the postpartum rooms located in the birth center, supported by staff who will help you recover from your delivery and bond with your newborn. For our pediatric patients, we partner with pediatric hospitalists from Swedish Medical Center, and they, along with our medical residents, help to provide 24-hour inpatient pediatric care. Our private, spacious postpartum rooms are your final stop before discharge. After recovery from your delivery, you will move to a clean room with a private bathroom. Typically, patients stay for 24 hours after a vaginal delivery and 48 hours after a C-section. During this time, we will help you learn to care for yourself and your baby. The staff are available to help as you bond and learn how to care for your newborn. They understand that this is a time for recovery and bonding with your baby and will give you space as a new family. Meals are provided for mom through admission with customizable room service ordering. Meal vouchers are available to purchase for support people. All our nurses are trained in supporting breastfeeding, and we have lactation available for more difficult feeding situations. To prepare for discharge, please have an available car seat and your government-issued ID for birth certificate paperwork, and select a pediatrician for your baby's care after you leave the hospital. Prior to leaving the hospital, a nurse will review your discharge paperwork and remove your infant security tag. You are now ready to take your infant home. Thank you for choosing Valley Medical Center for your care. We appreciate you trusting us with this special time in your life. If you have any further questions, we encourage you to discuss them with your provider at your next appointment or email us at birthcentertours@valleymed.org. Thank you for joining us on this tour, and we hope to see you soon.